Canada just signed on to the World Health Organization's pandemic agreement. It's to protect the world from future global outbreaks by being more coordinated in our response and sharing information. Now, I think more Canadians would be concerned to see what's in this agreement. And I noticed it's not really being talked about at a mainstream level. And so in this video, I'm going to talk specifically about some of the articles in the agreement that should be cause for us to pause for a second. And second, I'm going to talk about the real issue at the heart of this, which is trust with the general public. So as I said, the pandemic agreement is there to make sure that the world basically doesn't fumble a future global outbreak. And to do so, it says that there should be more detection strategies. We should share our data more transparently, strengthen vaccine distribution, and prevent supply hoarding. Canada was one of the countries where we bought up a lot of vaccines, but we didn't distribute them fast enough, and many of them went expired. But as you can imagine, to implement this means that there are some things inside this agreement that I think we would have concerns with. Take, for example, Article 4. Each party shall develop or strengthen and implement comprehensive, multi-sectoral national pandemic prevention and surveillance plans consistent with international health regulations. It includes early detection of outbreaks, especially at the community level, improving routine immunization programs, monitoring vector-borne diseases, and adopting a One Health approach which links human, animal, and environmental health under a single pandemic prevention strategy. So the way I read this is there needs to be a coordinated strategy that includes campaigns in specific communities and surveillance plans, which is a bit odd. Like, did you take your vaccine? How are they going to collect that data? And once they do, they'll probably start targeting even smaller communities to get higher rates of immunization as a result. It gets a bit politically tricky when it comes to Article 6 in the pandemic agreement. It states, each party shall collaborate with the WHO's health information systems, including through use of relevant international data standards for interoperability based on good data governance. So countries will need to align their health data systems together based on a certain global set standard, make it interoperable, and also easy for others to access with transparency and public access to health information. So our outbreak tracking, health information flow, etc. may very well now be defined by the World Health Organization. And I'll come back to it, but trust is at the center of all of this. Article 8 talks about our regulatory systems. In fact, it says that there needs to be a better way to get vaccines approved faster, and there needs to be transparency about approvals and safety monitoring. Each party shall make publicly available and keep updated information on national regulatory processes and information on pandemic-related health products that it has authorized. And then there's Article 16, and it states each party shall strengthen public literacy on pandemics and conduct research on factors that hinder or strengthen trust in science. So to me, this is getting to the why people distrust or mistrust government. And to me, that's the core argument that I have perhaps about or against the agreement. All its articles rest on this one simple fact or question. Do people trust their government? And what we find in countries where people generally don't trust their government, we see lower uptake of vaccines. In fact, the COVID pandemic was a great example. In countries in Eastern Europe, France even, parts of Africa, the percentage of uptake of COVID vaccines was very low. Eastern Europe, I think, was 30 to 40%. Parts of Africa was 18 to 20%. I think in France, it was around 50%. And in countries where perceivably there's higher trust in government, like Canada, the uptake of the vaccine was much higher. And then you look to the United States, where amongst Black and Hispanic communities, the vaccine uptake was surprisingly much lower than white Americans. And so there are groups within countries who distrust the government and as a result do not take the vaccine. And so while the WHO is fixated on creating standards on health and data sharing, etc., a lot of this rests on whether or not communities within communities believe and trust their governments. And it's not just in certain parts of the world. The National Institute for Health, I believe in the United States, did a comprehensive study, and it found that people are very willing to share their health information to their primary healthcare provider when it's about themselves. But if they knew that information was to be used for secondary purposes, say for research, by a private institution or by government, people were less willing to share that data, and the drop-off was so significant. And largely it's because they just don't know what's being used with their data, and that trust isn't there. So sometimes it's not just trust in government, it's also trust in what their data is being used for. And I would venture to guess, after what we went through in 2020, people perhaps even in countries that have high trust in government are perhaps even more unwilling to take a nationally approved vaccine because maybe people thought what we went through in COVID was not necessary. It's just a thought, but I would pose that to all of you. Would you be willing at this stage to take a nationally approved vaccine if we were going through a pandemic, or would you be more skeptical about it? Let me know what you think in the comments below. And what are your thoughts about Canada signing on to the WHO's pandemic agreement? Do you believe this is a net good for Canada? Let me know what you think in the comment section below. And let's keep talking about these topics because it seems like no one else will. Take care, everyone, and I'll catch you in the next.